And that's where we will begin with coronavirus, of course, because it has been a painful 24 hours in this country. Nearly 2,000 Americans died of the coronavirus yesterday. That's the most in a single day by far. This chart shows in very stark terms just how fast we got here. Just think about this. 5 weeks ago, only 9 people in the U.S. had died from the virus. You can see how the toll has certainly accelerated since then. Anthony?
And hospitals are still trying to find room for all the patients who need treatment. Our lead national correspondent, David Begnaud, is outside New York City's Javits Convention Center, which is now an Army field hospital. David, what's happening inside?
Anthony, there are only 66 patients inside, but they can hold so many more. So here's what's being done to increase the number quickly. You see those buses behind me? They just pulled up. They're picking up medical personnel to take them to hospitals around the city. That medical personnel from the military is going to start the transfer process to speed it up, to get those patients here, because they can hold as many as 2,500 inside the Javits Center.
The state of New York is in the middle of the deadliest week yet. Around 730 people died on Tuesday alone. That's nearly one person every 2 minutes.
Behind every one of those numbers is an individual, is a family, is a mother, is a father, is a sister, is a brother.
The city is now converting one of the largest churches in the world into yet another field hospital. But there is some good news. Governor Andrew Cuomo says that the state appears to be reaching a plateau in terms of hospitalizations.
We've been called to a bedside.
Dr. Sanam Ahmed, who works in critical care at Mount Sinai Hospital here in New York, recorded this video diary. She says she's been encouraged by the number of patients who were coming off of the ventilators.
It's sort of a reminder of the resilience that we have as human beings.
Top health officials are concerned about growing data which shows that people of color are at greater risk. The elderly population is also being hit hard at nursing homes around the country. There have now been 42 deaths at the Life Care Center in Kirkland, Washington. Another 32 people passed away at the Canterbury Rehabilitation and Healthcare Center in Virginia. And the Elizabeth Center in New Jersey has lost at least 12 residents. In Los Angeles County, the public health director now says it's appropriate to pull loved ones out of long-term care facilities if you are able to care for them at home.
She's definitely worried. I think she thinks this is it for her.
Wendy Aziz's 90-year-old mother, Dorothy, lives at an assisted living facility near Los Angeles. She's unsure whether bringing her home is the right thing to do. She called her Tuesday night.
If you would feel safer here, we'd love to have you here.
I know, and I love that thought. And I know you're a superwoman and you can do anything, but I don't even think you could protect me from this.
And here's hope for those on the other side. David Latt spent most of the last month battling COVID-19, including 17 days in the hospital, 6 of those on a ventilator. He says he did receive at least 4 different drugs, the anti-malarial hydroxychloroquine and the antibiotic azithromycin.
I think it's hard to tell whether the medications helped, hurt, work together. It's very hard to tell, which is why we need more research in this area.
David's 44 years old. He's a lawyer here in New York City, and he only had exercise-induced asthma as a pre-existing condition. He is home this morning, and the simple task of getting from the couch to the kitchen, he says, leaves him out of breath. But Tony, the bottom line is he is a survivor.
Yeah, more than 250,000 survivors globally, David. Important to highlight that as well. We appreciate that report.